Welcome to the College Connection podcast, a podcast presented by the College of Registered Nurses of Newfoundland and Labrador. This is the College Connection podcast.
Welcome to the College Connection podcast. My name is Kelly Kane, and I'm a registered nurse and a nursing consultant with policy and practice at the College of Registered Nurses. With me today is my colleague, Michelle Carpenter, who's also a registered nurse and a nursing consultant with policy and practice at the College of Registered Nurses. The College Connection podcast is made available for RNs and NPs as a resource to promote good practice and highlight the importance of regulation in healthcare. Today, we are pleased to welcome a special guest, Michael Morris, a nurse practitioner in specialized practice. So, Michael, let's begin with an introduction. Please tell us briefly who you are and what you do.
Happy to be here. My name is Michael Morris. I'm a nurse practitioner on the west coast of Newfoundland. My focus is heart failure, and I cover basically the western region of the island at this point in time in this clinic.
Michael, what is your educational background and training?
So graduated from the BN program at the Center of Nursing Studies in St. John's in 2014. And then I started my Master's of Nurse Practitioner through Athabasca in 2018, or 2019, and finished that in 2022.
Awesome, Michael. Is that, so you did your master's through Athabasca, and that master's program, the NP program, like is combined?
Yeah, so it's a master's as a nurse practitioner as opposed to a post-grad, all that kind of thing, yeah.
Okay, and through Athabasca, does that mean that was all distance?
Was all distance except for there was what they call a residency week or clinical week that we had to travel to Nova Scotia to do, which is kind of where we really honed in on a lot of our skills and hands-on kind of things, assessment skills. And then outside of that, there was a relatively significant portion of local practicum type stuff with physicians and nurse practitioners locally.
Okay,
and
yeah,
Michael,
go ahead, Michelle.
Go ahead. I was going to say, was your NP program in family all ages, or was it another category of practice?
Family all ages.
Okay, perfect.
Yeah.
Thank you.
That's awesome. Yeah, there's so many different options now, for people who are wanting to pursue nurse practitioner, having that option to do it distance, because of course, recognizing a lot of people, have their lives and you're working as a registered nurse. So, there is so many options now available. And I think that's great. Something that I've always been interested in, but I haven't done it. So I'm sure other people who may be listening may be interested as well. So I just think having a good idea of the various options is a good that you shared that. Perfect. Thanks.
Yeah, for sure.
Yep. So Michael, how long have you been practicing as a nurse practitioner, and in what type of healthcare settings prior to the position that you're holding today? So, because I know in our conversations you indicated you worked in a variety of healthcare settings. So tell us a little bit about it.
So from nurse practitioner standpoint, it's not as much of a variety. I've worked in the heart failure program. That's kind of what was where I've started. However, I do also work with virtual care through 811. But as a registered nurse, I've kind of been around the way. So I started in pediatric emerge, went to adult emerge briefly, then moved to adult med surge and pediatric inpatient, then moved to a bit of virtual care as a registered nurse, then went to the OR and also worked with endoscopy and medical daycare prior to coming into this position. So kind of touched a lot of places.
Absolutely. Wow. And we tell our nursing students, when we go into the first years, we talk about how vast the types of healthcare settings and roles that an RN and nurse practitioner can partake in throughout their career. And you're certainly epitomized those different roles. And pediatrics is near and dear to my heart. So I love to hear when people have worked in pediatrics. Kelly?
Yeah, that's exactly what I was going to say, Michelle, just about the variety of opportunities for registered nurses and nurse practitioners in so many different settings. So, perfect.
Yeah,
Yeah.
excellent. So, Michael, Newfoundlanders and Labradorians are seeing NPs in a wide variety of healthcare roles, and as we just talked about. And you practice in cardiac care, but you're in a specialized area. Can you give us an overview of what your work consists of?
Yeah, so I mean, heart failure predominant is what I do. So I like I said, we're trying to change the clinic a little bit, the vernacular, more so heart function clinic, but it's been heart failure clinic for so long. But anyway, so basically my focus is to take patients in who have been diagnosed with heart failure, or and generally they're documented heart failure before they come to me. So they've had an echocardiogram, they've had some kind of testing that shows that, okay, there's something going on there that would fit in this clinic. And then basically what I do is I focus on trying to, first of all, get them onto guideline-based therapy, the best guideline-based therapy as they can tolerate. And then kind of whether, like, if it's kind of unsure why they have heart disease, well, then it's to go down that route and assess them, different investigations, referral to different people if appropriate. And I mean, it's a significantly wide variety of reasons why people end up with heart disease. So it can be quite complex. Sometimes it's a pretty straightforward answer. Sometimes you can see significant improvement. Sometimes, you're happy if people stay status quo. So it's definitely been a huge learning curve and continues to be, because heart disease is such on the forefront of research right now too. So, there's, you think you might have got your head around something and then something new comes out. So it's really fun like that. And then I guess, because people don't have primary care in a lot of cases, you do touch on a lot of primary care in practice as well. So, that's a little aspect of it as too. Now, don't get me wrong, I'm not doing the same thing as primary care providers, but,
No.
you still get your little sniff of it here and there.
Yeah, very good.
And Michael, do you, I know I'm Newfoundland and Labrador, just statistically speaking, do you have any sort of, statistics about heart health or heart function in Newfoundland? Like, are our rates still really high, like comparatively across the country?
Yes, we do still have high rates. I can't think of it off the top of my head.
Oh, that's okay.
I could find it if you wanted the information to post somewhere, I could get it for you pretty quickly, but I can't think of it right off the top of my head. But yeah, we do. And what I would say is that through sitting through, several or a couple of heart failure awareness weeks and stuff now, where we work with, Heart Stroke Canada and all this kind of stuff, they have kind of credited Newfoundland with some of the most forward thinking when it comes to heart failure and heart disease. Now, again, sometimes our resources are a bit more limited, don't get me wrong, but from trying to promote heart failure and trying to move forward with practice, we are doing well in that regard. So, yes, we do have a high prevalence. And I think it's probably even higher than people would think, because, people aren't getting checked out, or, or whatever the case may be. Primary care becomes an issue there too. But I think we're making good steps forward for sure.
Yeah, and you talk about, because you do have a little bit of that primary care. So I guess, I mean, a large part of your role for sure must be educating, some health promotion in there.
Yeah.
Those sorts of things for the clients. Yeah.
And credit to the primary care providers that we have. They're phenomenal all the way across the province. Obviously, and they're spread very thin as it is. And so, certainly not any fault of anyone in the primary care field. It's just that, there's so many people who aren't even touched through that. And so that's a bigger issue that we've all heard about many times.
And Michael, you talked about best practice guidelines. Can you talk a little bit more about those?
Yeah, so heart failure, we have really good guidelines here in heart failure. Now, I will say that from going to conferences and different things like that, the heart failure guidelines are relatively similar when it comes to, you look at American, you look at, European, like there's a very, very similar subset of guidelines there, because it's relatively agreed upon how to approach this. Now, again, things differ, new research comes out, but there's a set of medications that we know are very beneficial in certain situations. There's different testing that we know and different parameters that we know that we need to try to reach to try to get there. And the people who get there generally have the best outcomes. Again, that differs depending on, again, why someone has heart failure. Is it because they have a blockage? Well, that blockage needs to be fixed. Is it because they have a valve issue? Well, that valve might need to be fixed. Is it because they have sleep apnea? Well, again, but generally there is like a core set of things that we want to try to get people into. And yeah, no, it's very progressive, very, very progressive. It's really interesting right now. Yeah.
And, a lot of clients or patients want to be educated on their condition. Are they able to look those up online? And are they accessible through like the internet, or is it something like within the realm of the healthcare professionals?
No, so Canadian Cardiovascular Society has all this stuff posted, and so they have the heart failure guidelines. There's an atrial fibrillation guideline there.
Okay.
There is dyslipidemia guidelines, so for cholesterol. There's like little pocket books, which are really quite nice. I have one actually right here behind me, if you don't mind me reaching back to get one.
Sure. For our
so kind of look like this. And so there's different color ones for different things. There's a diabetic one as well, but that kind of goes through Diabetes Canada more so. Really nice kind of breakdown of things. Now, some of it may be above the general population understanding, but at least, it's coming from somewhere, and it's well researched and well backed. And I can't remember exactly. I think it might be 2026 that we're expecting a new set of guidelines, I believe.
Okay.
So there's some new information coming out there, which is going to be pretty interesting as well.
Yeah. So for our listening audience, you can see this recording on our archived events and YouTube. So you'll be able to see Michael where he held up the pocketbook. So that's great, though. No, perfect. Kelly?
And Michael, so you did describe a little bit about your patients, but what type of patients do you primarily work with? I know you mentioned about heart health, but do they range in, age, maybe like social background, those sorts of things? So what kind of patients do you primarily work with?
So age would be the kind of one defining thing that would make it like okay, sorry, what am I trying to say here? There's a specific age group that I mostly work with, yes, and that would be elderly population. So you're looking at your 65 plus, I would say, is the largest chunk. I do get some younger people there. Like I do have some people, obviously, of different age ranges, but that would be the predominant one there. You do get some people who are younger who have had, say, a massive heart attack or something like that, and it's left their heart weaker than other things. So there is those people, and there's some interesting genetic cases and things along those lines that I won't get too much into it but predominantly, yes, it is elderly people. Yeah.
Okay. And how involved are you in diagnosing and managing patient treatment plans?
So yeah, kind of as we were talking about before, with regards to diagnosing heart failure, generally, a common pathway to me is that they may present in the emergency room. They come in with symptoms of congestive heart failure, so shortness of breath, fatigue, swelling in their feet, all those kind of things. And they get their workup. They might get admitted. They get an echocardiogram usually. And the echocardiogram will show that there's some kind of cardiomyopathy there. And then they will come my way. So depending on what kind of workup they've had done prior to that, I mean, it may be, maybe we'll start by sending them to, maybe they need a stress test done. Maybe they need, a CAT scan done to see if there's any kind of calcium in their coronary arteries. Maybe they're this certain type of patient that comes in that right off the bat, I say, you know what, I should get internal medicine involved in this one right off the bat because of the complexities involved here. And oftentimes they will have already seen these people in hospital if that's the route they came. But if a primary care person provider had referred someone here, they may not have seen internal medicine yet, and so sometimes we'll kind of do that pathway and we'll see them together. So again, diagnosing the heart failure point of it is kind of done when they get here, but it's really trying to break it down as like, okay, where is the heart failure coming from? And I really want to point out the fact that sleep apnea is significantly important when it comes to heart failure. And that's a big one that I've learned, that diagnosing sleep apnea can be significantly beneficial in treating it with CPAP. Yeah.
That's really interesting. I hadn't heard that, that link before, the sleep apnea and heart failure. So that's a really interesting fact that we learned today.
Yeah, for sure. And I didn't know either. Honestly, it's a relatively like within the last year and a half or so that I've noticed how significantly beneficial it can be for someone who gets treated properly for their sleep apnea.
That's interesting. I have some family members that have sleep apnea, so it's an interesting fact to take back. So
Right.
so thank you. It seems to be common that MPs are playing multiple roles in the healthcare system. And very interesting, you mentioned that you worked with 811 as well. And we see a lot of nurse practitioners now having 2 and 3 employers. It really interesting that you are, in your heart failure clinic, but you said you also do some primary care, but then you've gone right over into, primary care and doing 811. So can you tell us a little bit about the work that you do with 811?
Yeah, so I think the virtual care platform, certainly it is expanded quite a bit. Obviously, COVID times and all that kind of stuff. But in Newfoundland, it kind of always was a necessity to some extent because of the expansiveness of Newfoundland, the lack of providers, especially when you look in Labrador. I mean, the expansiveness of Labrador. So what we do there from a nurse practitioner standpoint is, we provide that primary care link to people who, don't have it otherwise. And, a lot of it does come down to helping people get their medications refilled, diagnosing and treating kind of general things, ear infections, throat infections, again, you're limited on virtual care because,
Yes.
Most of the time we're not even seeing the patient. We're just talking to them over the phone. We do have to take their word for it. But it does become kind of a skill to try to squeeze the information you want out of them. And that can be challenging depending. And so again, now, as we talked about briefly before, my focus again right now in 811 is kind of a controlled substance subset. And so right now we're trying to help people out who need substances that, again, an example being Concerta for ADHD or something like that, where they don't have primary care and it's not easy for them to get otherwise, and they need that medication because, it's significantly detrimental. They don't get it. And so we have a very strict set of rules around that. And it seems to be going very well. Again, it doesn't necessarily take the place of having an in-person primary care person, but it allows them to get what they need. Credit to 811 system, and because there's both RNs, NPs, and the other staff that work there, it's a humongous group of people. And it's a really good community. I mean, you don't have to ask any questions or anything like that. So it's a good learning experience as well, because I think I don't know the number off the top of my head. There's somewhere between 50 and 70 NPs there, I think.
Okay.
And I mean, the various backgrounds that people have, and we do our own education sessions and all that kind of stuff, from different people who have different backgrounds. So it's a good environment for learning, and it's certainly a service that is providing something that is needed in the island.
Well, yes. I mean, as we know, there was many Newfoundlanders and Labradorians who did not have a most responsible provider. From, before COVID and then during, 911 has expanded greatly. So are you providing services in just primarily in the province, or do you provide services across the country as well in this role?
Just in the province because well, yes, just in the province as of now. And I know that there are MPs that are licensed in different provinces. And so I don't know if there's any plans to, I don't know, honestly, if there's plans to expand that or not.
Sure enough.
And I would like to highlight too the huge benefit to the public in Labrador that 811 offered during the fires with displaced patients and everything. Credit to the people who were working during that time, because they were very helpful in helping people getting what they needed, and the pharmacies as well, working up there, of course.
Oh, great. Okay. Well, thank you.
Yeah, and speaking from someone who had to use 811 many times with a young child at home and without a primary care provider, it's such a great service to be able to avail of when needed. And like you said, Michael, sometimes it may not always be appropriate, and the emergency visit is unavoidable. But sometimes it can definitely fill that gap. So that's really good.
Sure.
Yeah. And, when we get a lot of questions, Michael, about virtual nursing practice, and, one of the things, requirements, I guess, in that, in our virtual nursing practice document is about, getting the education and training to use that system and to be able to conduct an assessment virtually. So it was really interesting that you talked about that. Did you want to add on to that point? Or
I would mention as well too, I guess not specific to NP practice, but when I worked there as a registered nurse, there is kind of again, it's very regulated, right? So, which is good because it needs to be, and they have a really good set of guidelines and everything like that for basically everything you can think of under the sun. And it's really good for learning, again, how to I remember as an RN, how much I was learning how to, the right questions to ask, right? If it wasn't necessarily something that came to my mind. And so that does come forward to actual practice at some point too, right? So it's been a good experience, and it's why I'm doing it still, is because it's been a good one. And I think it does help. It does help with this too, right?
Yes, absolutely.
Great.
Yeah, which kind of leads me into the question that I got next is, how do you stay up to date with clinical and healthcare advancements and best practices? So you just touched a little bit. So do you want to expand on that? But I can see where you said, your experience that you get in 811 would transfer into your clinic. So so if you could expand.
Yeah, so I guess first off with that would be, I guess we'll talk about the heart failure aspect of it too. Just ever changing information, literature is always changing. There's so many specialists in it that are coming forward with, different exciting research and all that kind of stuff. So that's a big part of it. Collaboration with the specialist and the primary care people that I'm with, are always kind of going back and forth with each other. Hey, did you see this? Did you see this? What do you do in this situation? So, somewhat of an informal way to keep up with things. But, again, conferences are one of the formal ways to keep up with it. The education sessions there's a ton of them. Once you start getting connected in the right circles, you can get all these access, anyone can do it. It's just, just different education sessions with really highly specialized people. There's always online conferences you can go to, and just article research. But to go back to what I said about the 811 is that there's lunch and learn sessions there. And so because there's so many nurse practitioners, you have people that are good with, works directly with women's health, might work directly with controlled substances, might work directly with heart failure, liver transplant, things that are really niche that you wouldn't really know about if you didn't have someone sit down and talk to you about, and you don't see it every day.
Absolutely.
So, it's pretty easy to meet that CCP requirement, but it's also quite easy to blow past that and get a lot of stuff that's actually really interesting. Like you don't like I don't need to force myself to do education because there's so much there throughout the year that I'm interested in anyway. So it's really fun like that. It's really good. And I think it's important to make sure you're keeping up with it because if not, it's easy to get behind.
Yeah, and absolutely. And, that expectations in our standards and all of our requirements as a licensed professional, but, keeping up to date and being able to provide that best practice, that evidence-informed care to our clients, provides quality outcomes from our clients. And you've just said that Newfoundland has been recognized for the actions and the measures that's been put in place for heart failure. So kudos to you and to your team for those actions. But yeah, keeping up to date is really important. So is there like any particular journals or that you do read on a regular basis with heart failure or?
So first, just real quick,
Yeah.
kudos don't necessarily deserve to go to me. It should go to I'm relatively new to this. There's been a lot of work before me and ongoing. So from my heart failure and nurse practitioner colleagues in St. John's, as well as some of the cardiologists and some of the directors and everything. So I want to make sure it's directed. I'm a small part of it, but
sure,
they're a big
part of the team. Part of the team.
So with regards to journals specifically, you have your Canadian cardiovasculars, things like that, but
Yeah.
I'm joined up with the Canadian Heart Failure Society and the Heart Failure Society of America, and so just various things constantly coming up. And so, I don't necessarily have a loyalty to one.
Okay.
Journal versus the other. I try to make sure that, you're looking at things, even if they're in a disagreement, because, well, that's helpful
Absolutely.
too.
Mm-hmm.
One thing I will say, and I say this with a grain of salt, is social media, if you know how to filter it, can be very helpful because, certain platforms you can follow, certain people that are posting really up-to-date information who are in the information, who are the ones researching it. But you also do need to be careful with that too. So, I'll say it with a grain of salt, but it has been helpful for me.
Okay,
That's
good.
that's an excellent point, Michael. It sounds like when it comes to keeping up to date, you are, I guess, you're taking a lot of that on yourself. You said it's very easy for you to find that, but to me, it sounds like you're saying that, you are networking and connecting, collaborating with people to find those opportunities. Would you say that's accurate?
I'm trying. I'm new to it. Again, I'm learning from the people who've been doing it longer than I have, who are exceptional at doing that. Being part of the research and networking and everything. So I'm stepping into it. It's definitely unfamiliar to some extent, but even the little bit I've done has been super helpful. And like I said before, like making connections and then being able to do like virtual conferences and everything. It's you get your name on an email list and a lot of opportunities open up, right? So and anyone can do that. It's just find yourself in the right situation. Yeah.
Absolutely. I'm just thinking about, the day to day, you go to work, you're seeing your patients, but, taking those steps to open those opportunities, I think are very important for registered nurses and nurse practitioners.
Absolutely.
Yeah, because there are opportunities, but yes, sometimes they may not fall in your lap. You mentioned 811 has lunch and learns, which is wonderful. The employer puts those off, but sometimes it comes, it's within ourselves to seek out that information that we need. So so thanks for sharing that.
Yeah, absolutely. I mean, just to close it off real quick is just there's no harm in just reaching out to sometimes it's a drug rep, sometimes it's whatever, and these people, like these different positions, their job is to provide information, and so that's their role and they want to do it. So they love when people reach out to them and ask them questions. So, I would encourage anyone to do it, whatever the role.
Perfect. Thank you. So, Michael, in addition to your role as a nurse practitioner, you are also a member of the council, which governs the College of Registered Nurses. Can you explain why you decided to get involved with the College Council and why you think this work is important?
Yeah, so I mean, my original reason for getting involved is because I didn't understand what regulation was, and I still don't know if I fully do. I'm learning constantly, and there's so many people who are involved, the reps, the public reps who have been phenomenal, and trying to that's kind of it was an unknown to me, and I wanted to try to get involved with it, and so that's been probably, I mean, I'm still on the upswing of that learning curve, and I think regulation is really important in today's world, and that the work that you guys have been doing, for different programs, and I mean, it's all over the place, honestly, the way you guys have been doing. So it's important because you can't just allow anything to come in, work within our public, and then not scrutinize it, or not have an all-seeing eye kind of to some extent on things, because again, the ideal is public protection, and if we aren't scrutinizing the people we're allowed to practice here, or the practice standards that are here, then when does it come to an issue? When does it come to a head? And then it could be a danger to the public. Now, again, sometimes there's unforeseen stuff that happens, right? But, I think you guys have done a very good job, and, at looking at things with good perspective, and trying to allow people to practice within their scope, but also making sure that the public is protected. Which is very challenging at times, I'm sure.
Yeah, and I'm relatively new to the college as well. I've been here just over a year. So it was a huge learning curve for me as a staff member here at the College of Registered Nurses as well, because similarly to you, Michael, I don't think I had a true grasp of what we mean when we say regulation and self-regulation, and that impact on public safety, and how our mandate is for public protection. So, and it can get very we sometimes make it confused with the nurses union or other associations, but linking back to our mandate, which is public protection and nursing regulation, sometimes that can be it's a different world here sometimes, but very important work.
Yeah, no, I still find myself struggling with that at times, because my initial thought, when you sit down and you get something presented to you, my initial thought often goes to, well, you're not standing up for, this, but at the end of the day, yes, okay, it's not an association. It's not, it's challenging. Changing your mindset to that can be challenging. And so, I'm happy that I'm not necessarily the one person that has to do all that stuff. But it's been very interesting and kind of eye-opening, honestly.
Yeah, we talk a lot about, when we do our presentations, about what is self-regulation, and and just by you being there as a representative, and being a nurse practitioner, it's that nursing is governing nurses, and you made a good point that we have public reps, right? So being a part of that regulated profession means that there's oversight, and the college board has been given that responsibility. But you talked a little bit about public reps, and I don't know if all of nursing or the public realizes that, yes, while we have 10 registered nurses and nurse practitioners representing and providing oversight of the nursing profession, we also have 4 public reps, and what their role is to ensure that what we meet what's in the RN Act, in the regulations. So, so do you want to comment a little bit more about that, and that interaction between nursing and the public reps?
Yeah, so I mean, the public reps that we have, they've been there longer than I have, and they understand regulation quite well. And I know that they've been on different councils on different things all across the province, and maybe further, I'm not sure. But one thing that it probably gets pointed out at every major council meeting, and maybe more than that by some of the public reps, is, when we start going into nursing vernacular or healthcare vernacular and kind of start spewing off whatever we're talking about, and they kind of say, well, hold on, what do you mean? Like, and that's because, again, if you're an engineer and you start talking to engineer, I'm not going to know what you're talking about. So if we're going to protect the public and we're going to make sure that, we're doing the best, we need to make sure that our language is fair to that as well. And so that's one of the main things that, they've significantly helped, making sure that we're communicating effectively when maybe we think we are, but we're not, because we're talking to the public, not necessarily ourselves. But again, the other part is just the significant skills that they bring to the table, whether it be financial, whether it be, whatever the case would be, things that we as nurses don't know. Unless privately, maybe you do, I don't know. But most of us, we're not taught in all that we're not educated in that way. And so having people with different perspectives and different walks of life and whatever the case may be is that's a big thing for sure. And it's been very helpful.
And Michael, not only like attending the 3 council meetings, you also sit on some council committees. Can you tell us a little bit about those committees that you sit on?
Yeah. So, well, the oh my goodness, the appointments and nominations kind of committees there.
Yeah.
Those have been, relatively, kind of picking up a bit more there now.
Yes.
Just trying to see, if, because we're working towards, competency based.
Yes.
And so that's kind of the, something that we're really focusing on right now, and making sure that the council that represents both the public as well as the nursing practice has a wide variety of people who can look from different perspectives and may be able to offer insights that we haven't yet seen. So that's been interesting for sure. The other one is the CAC, so the kind of disciplinary type meetings, which have been very interesting. Again, eye-opening. I can't really get too much into it,
No.
I guess, but a big learning curve for me, because it becomes into the legal aspect of regulation, and so it's been really interesting for sure. Yeah.
Yeah, that's great. And you and I have an opportunity to work together on the appointments committee. And as you said, absolutely, that role is really evolving, in that we're moving towards that competency-based board. And, that first step was this year with the call on nominations, we identified 3 competencies that council members identified from a competency matrix that were lacking. And, if a registered nurse or nurse practitioner felt that they had those competencies or those assets, that feel free to put their name forward. Not necessary to have those competencies, but to if they had that prior knowledge. So that was really good. Michael, a couple more questions for you. So what, if anything, inspired you to become a nurse practitioner? Pardon me.
I think the biggest thing for me, again, like as you've seen, I kind of bounced around, a couple different things. It's never been that I haven't enjoyed where I worked, but I just was finding, I was just always kind of wanting more, right? And I didn't really know exactly what that more was, and I felt that having a bit more autonomy in my practice certainly might open up some opportunity there for me, and I think it has. And again, it's not to say that nurse or registered nurses don't have autonomy, because in some positions, it's significantly autonomous. But for me personally, I kind of, that I was looking for a bit more, say a little bit more independent practice from what I had personally come across. And so, because I don't think it's necessarily, that you need to be an NP to have a desire for more knowledge, because my goodness, there's registered nurses out there who know everything. So, it's by no means a shade on a role or anything like that. But for me personally, I think it just opened up the doors that I wanted open, and, so far so good. So,
Absolutely. And Michael,
Mhm.
nurse practitioners, they do have that expanded scope
Mhm.
and that advanced knowledge and advanced competencies, to work to that higher level as well. Because yes, of course, like you said, registered nurses, they have a wealth of knowledge, but NPs having that advanced education, you have that advanced skill set, right? So you can do other things that perhaps interested you.
Yeah, and I'm hoping that I think we've talked about this briefly within council as well, is I'm hoping that, moving forward, in Canadian practice that we can like kind of do a bit more actual like certification specialty in nurse practitioner practice. So yes, I'm a heart failure nurse practitioner, but that doesn't mean I didn't go back and do like a residency in heart failure. So it's been a lot of learning as I go. Don't get me wrong. So I'd love to see practice, expand to, okay, you want to do pediatric emerge, okay, well, let's go do a fellowship, for lack of a better term, in pediatric emerge or something along those lines. I think that's where I think that's where it's going, and I think that that's going to be exciting because again, it allows you to branch out even further. So it's expanding in Newfoundland and in Canada, but there's a lot of moving pieces still going on there. So yeah,
Yeah.
it's good.
Yeah, and with the one category of practice and the one registration exam, that new model of NP regulation is the purpose of that, is that you graduate, being able to come out as a nurse practitioner, and you come out and you're caring for clients across the lifespan in a diverse number of practice settings. But then the view is that there'll be specialization that occurs and courses that occur that will allow you to become specialized in a particular area. So that is definitely the vision for the future. And it's going to take us a little bit of time to get there, but we're moving
Right.
forward. Absolutely. There's different organizations that are looking at getting into those specialization courses. And it's interesting that you said, and I hope after the listening audience hear you today are inspired to become a nurse practitioner. But when I came here 9 years ago, it was less than 100 NPs, and today we're up to almost 360. So in that short period of 9 years, then there's been a growing number of nurse practitioners that are licensed in Newfoundland and Labrador. So
For sure. Yeah.
yeah. So Michael, to conclude, can you advise RNs listening who might be interested in becoming a nurse practitioner in the public service sector? What are some rewarding aspects of your work, and what are some challenges?
So, I mean, the rewarding bit is I feel like it's nice to be able to put together a plan for a patient by yourself.
Mhm.
There is, some aspect, it's not everything is exactly by yourself, but when you put together a plan by yourself and implement it and it works, it's very simple and that's helpful. And I look at, colleagues who work in primary care in rural areas where they are the only ones there. And if they weren't there, um, these people would have to travel for hours and hours and hours to get. So, I imagine that there has to be immense satisfaction that, you can manage people in your area, and, significantly improve their quality of life and cut down on the stress of the system in, emergency rooms and everything like that. So I think the satisfaction of just being able to kind of, potentially start to finish by yourself and be able to directly help the patient is part of it. Um, Again, and also understanding how to make the decision when maybe it's above you or maybe it's something that for me personally, like if someone comes in and I feel like, oh, you need to go see someone more specialized than me. Well, the satisfaction of making sure that they're getting to the right person, that's nice as well. Um, Challenges, I mean, again, I think the growth of nurse practitioner practice is a challenge in its own right because, we want we want to be practicing in all these areas. We want to make sure that we're able to do our full scope. And again, it sometimes is a bit of a challenge because we don't know exactly where that stands. And again, because things are growing so fast, that becomes a bit of a gray area more and more and more. Um, that's one of the things. And I think I think that there is an aspect of, wanting to be recognized for what we can do. And trying to have a voice to say, we are valuable here and we do a lot across the province. And I think that sometimes people don't feel like they're being heard, both in the public and otherwise. And that can be challenging too. I think there's a lot more good than negative right now, a lot more positive than negative. But I think that it's good that there's some motivation to keep pushing forward, because if not, then we'll stagnate. So I think that we just need to make sure that we're working together, and everyone's working together, because if we start dividing apart away from each other, even though people have different goals, we got to stay somewhat united, because we are still relatively small, right? And there's people in private practice, public practice, et cetera. So we just need to make sure we kind of try to stay united as much as possible, which can be challenging at times, for sure.
Yeah, and I think this is where your Nurse Practitioner Association of Newfoundland Labrador Nurse Practitioner Association is doing a great job of trying to make the role of the nurse practitioner known to the public, and are collaborating with government and the healthcare system to advance the role of the nurse practitioner. Being the regulator, that's not really within our mandate, but we do collaborate, right? And those issues that you're talking about, we do sit on committees at government and within the healthcare system to give that perspective from a regulatory perspective, but then the Nurse Practitioner Association is there to give it to from that perspective of the nurse practitioner. And so they've done some fine work as well. So yes, well, thank you. I appreciate your candor.
Yeah,
absolutely.
No
and Michael, just thinking about like some of the challenges, because you spent some years as a registered nurse, and typically speaking, when a registered nurse goes into a new practice area, they have like robust support system around them, other registered nurses and people directly available, whereas a nurse practitioner may graduate and go somewhere rural without having that support system around them. So I think when you spoke about kind of united and sticking together and learning from one another is so important for you all, because you are you do have that advanced knowledge, that advanced scope of practice. And so the risk is greater, because of things that you are doing for clients. So supporting each other the best that you can, it must be very important and valued.
Yeah. And again, not everyone's going to agree all the time on things, right? That's the nature of human nature. And so, that's part of it too. But I think it's all coming from a place of wanting to progress. And so, eventually things, will or have, or, will come together and kind of push that way. So, again, it's progressing just like everything else.
Yeah.
Perfect.
Okay, so that concludes our episode with Michael Morris, a nurse practitioner in specialized practice. So thank you, Michael, and thank you to our audience for tuning in to today's episode.
Thank you.
Thank you.
So we've stopped recording.
This has been a presentation of the College of Registered Nurses of Newfoundland and Labrador.